Welcome, everyone. Can you hear me?
Yes.
Very good. Welcome to the December 12th Road Gateway Rotary meeting. Thank you, our readers, Renee, Orange Priester, and Allison Cabinet. Let's have the flag and four-way.
Allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And of the things we think, say, and do, number one,
Is it the
Truth.
two,
Is it
Fair to all concerned.
number two,
Build goodwill and better friendships.
beneficial to all concerned?
Inspirational moment, here and Clark.
I would share a short story, not a long story, about my grandchildren for inspiration. Our granddaughters were visiting us in Oregon, ages 8 and 6. So Mary's 8, Jordan is 6. So when we met Jordan, she's now 16. This is how long ago it was. A Sunday chilly morning, we're on our way to church, and the girls are in the back seat of the car. And we're in the Rogue River area, and we're driving by the Murphy Plywood Mill. So Jordan looks at Mary, and she was getting excited about something. So this visual moisture that's coming into the air, you know, the warm air getting the cold air, and then you see these large puffs of white smoke beaming up towards the sky. And Jordan says to Mary, 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 I found the cloud maker. So this season made me think of clouds and childlike innocence and the humor they bring in our lives. Thank you.
Thank you very much. Thank you, Mary. Okay, do we have any visiting Rotarians? How about Rotarians with guests?
Hey, everybody. I'd like to introduce my friend Lori Johnson and her brother, Philip Foster. I work with Lori at the college, and every Thursday when I leave, I say I'm going to hang out with the do-gooders. She was a little bit curious to find out who the do-gooders are, and so here she is to be called you.
Well, welcome to you. Thank you for coming in. We're going to ask, we have a new member today, and Carol Jordan, I think if you would come up, and I will have Amanda Sloan come up and introduce you.
I brought Carol here because I so enjoyed coming to these meetings, and we were talking about it. And we decided that maybe it could be something she'd like to do, because it's an organized group that does good things for the community. Carol brings a wealth of experience and heart of service to our club. Originally from California, she moved to Red Hat in 1992 to work with the Josephine County Planning Office. During a time of rapid development, Carol collaborated with the Rural Planning Commission, Board of Commissioners, and Permit Office, relishing the opportunity to engage with the community and to shape its future. So as we know, she must be very patient. She's a passionate animal lover. Her email is Carol and 3 cats. It reflects her love for felines, though she now shares her home with just one cherished 13-year-old cat. Her commitment to animals extended to 9 years of volunteering at the Josephine County Animal Shelter, where she supported a front desk operation and cared for the cats. Carol's superpower is organization, and I know that. One of the things I was attracted to. A skill she honed from during her 3 years as president of her homeowners association, and many interesting jobs through her career. Her adventuresome spirit is just as remarkable. Is at age 21, she and a friend spent 5 months exploring Europe. After losing her wallet, money, and airline tickets in a cafeteria line, Carol demonstrated resilience and resourcefulness, navigating embassies, youth hostels, and hitchhiking across Austria, her favorite destination, all on $10 a day. With a rich and varied life, Carol is excited to join Rotary, because of our shared mission to serve the community and those in need. She's eager to roll up her sleeves and make a difference. We're thrilled to have her on board and look forward to all she brings to our club.
Would you like to say anything? Welcome aboard.
I thank Amanda for inviting me. This is a pleasure. I know I am going to thoroughly enjoy.
Into the mic.
I'm going to thoroughly enjoy all of you. In getting to know each of you more than you're getting to know me, I'm going to get to know each of you. So I really don't have too much to say about myself. I survived 10 years on the Berkeley of California campus during the 60s. You were there? We were in environmental design, and I did survive. It was quite a challenge. Ronald Reagan was a president. No, he was a governor at that time. And it never failed that on my way home, walking home from work, he would send, because there was lots of activity going on, he would send a helicopter with the spray. Just smelled horrible. And when I got home, I had to change all of my clothes. So anyway, that just is one of my many experiences that I've had throughout the years.
Well, thank you so much.
Thank you. Thank you, thank you.
Well, thank you, Carol, and of all of that, of course, we all know that the single most important thing is that she survived 3 years on the homeowners association of board somewhere, so she's gonna fit in very well with this crowd. Okay, really couple of quick announcements, come on up.
Okay, today's the last day for Operation Enjoy Christmas cards, and a whole bunch of people brought in today filled out, but I do have these 3 boxes that need to be filled out. If you want to take some and at your table during the meeting, after the meeting, help me fill these out, I would really appreciate it. Thanks, everybody.
So what's tonight? Doug and Kirk Brown came over today and picked up all of our supplies, so we're ready to go, and we'll be meeting everybody there at 4:30. Don't forget, do not park up by between the PAC and the common area, even if you're going to be taking the backpacks to a school, park down below, then when the backpacks are done, you can bring your cars up to be filled, just because they do have stuff going on and they're very adamant, they do not want us parking there. So we'll have the vehicles for only during the time that we're unloading, and then we'll go from that. Now, what's next Thursday? Ornament exchange. So we got lots of fun stuff coming up, so thank you, and looking forward to seeing you all tonight.
Okay, so I'm going to be passing around the sign-up sheet for January. And I want you to notice that it's, first of all, January 2nd is a day off because many of us will still be recovering. And then I would like you to note that there's a second page that you must please read if you are interested in signing up for Sergeant at Arms, because at our last admin meeting, we kind of expanded, okay? And then if you have any questions about it, I'm gonna target two people, Doug Walker or Luce Kramer. They will be your, they will be your people to help you with it.
Okay, I want to announce the, youth programs that we are going to fund through our Push Fest fund. So a committee got together, made recommendations, the board looked at the summary and then voted. So we are going to support the Boys and Girls Club, Crossing Youth Plus, Crossing Bridges Therapeutic Riding Center, Redwood Play for All Inclusive Playground, and GP District 7 Early Learning Program.
Okay, now I think Steve Roll is going to introduce our guest speaker for today.
Thanks, Steve.
Well, it gives me great pleasure to introduce Sheila today. Sheila, I first met in, when she came from Wisconsin, I believe, to the Ashland Community Hospital. And she was the CEO there for a number of years, and then left there to become the CEO of Mercy Points. And she called me at one point and says, you know, on the board there, and she said, would you be willing to be the Josephine County representative for Mercy Points? And I really didn't, I've been a member of Mercy Points, mainly because of my crazy snowmobiling chances of injury up at Diamond Lake. I always felt that Mercy Points would be there for me if I needed to. And, but they really do serve a valuable role, and they've expanded into, they're a unique nonprofit, and we're gonna learn a lot more about it today. So please help me welcome Sheila. Sheila was also a member of Rotary for 25 years and was very active on youth exchange on the district level. And she's got some great stories to share about that at another time, I'm sure.
Thank you so much, Steve. I really appreciate this invitation. And I was a former Rotarian, and Rotary is in my blood, and you can't get rid of me, even if it's for a short period of time. So it's an honor for me to be here and talk about Mercy Flights. We've been serving and enhancing, saving lives and enhancing lives for the last 75 years. I'm assuming, Doug, you and I are partners.
We are,
And
yes.
it's just like Vanna, where the Pat says, perfect.
Just tell me.
Yeah, perfect. Next slide. So I wanted to start my comments today just with an acknowledgement of you. One, because I am a former Rotarian, but two, because of your mission mindedness. Rotarians are community minded, mission minded. You're here to serve the community. And that community mindedness is very similar to Mercy Flights. And your new Rotarian, she was one of the first ones who showed up today. And she and I were commenting about how incredible Rotary is with not only service to this local community, but what you're doing internationally. And I know that's what attracted me to Rotary 25 or more years ago. Next slide. So thank you on behalf of the community for what you're doing to serve locally and what you're doing to serve internationally. Next slide. Some of you know our history. We started in 1949, and it started with this gentleman. This is George Milligan. George was an avid pilot in Southern Oregon, and he was an air traffic controller at the Medford Airport. George, and apparently many others in the community, were kind of pilots, and the pilots and the healthcare workers all kind of hung out together. So they got to hear stories about what was happening in their different professions. Well, what was happening in the 1940s? Now, this is a little bit of a Rotary question that will link to Rotary's roots. What was the healthcare challenge that was happening in the 1940s? Polio, that's right. Well, polio was also happening here in Southern Oregon. And the only iron lung, does anybody know where the only iron lung in the state of Oregon was located? Not Eugene. It was not here. It was not Bend. It was Portland. There we go. There we go. It was in Portland. Now imagine I-5 in the 1940s was likely not a very well-established route. I-5 is not a very well-established route right now. Imagine if you had polio and you had to be packaged up in the back of an ambulance and you had to take that long journey up to Portland for treatment with the iron lung. That was not a pleasant journey. And oftentimes patients would not survive that journey. That slide we're on. That's the slide. Well, unfortunately, one day, the person that was in the back of that ambulance that had polio was George Milligan's best friend. And unfortunately, that patient did not survive that trip. And George had had enough. He was community-minded, he was a little tenacious, and he said, enough is enough. And he marched up to City Hall and he said, we need to do something about this. And he told the mayor at the time, he said, I think we need an air rescue operation. I am going to be your first volunteer pilot, and I have a whole bunch of friends of mine who are in healthcare, who are aviators, and we're all gonna create this not-for-profit organization and serve this community. Next slide. And so that's the beginnings of Mercy Flights. In 1949, it was the very first not-for-profit air ambulance company in the nation. There you go, there's your trivia question. Well, shortly after starting Mercy Flights, George realized that having an air operations organization was pretty expensive. And he wanted to make sure that these services were available for anyone in the community, anyone in Southern Oregon. And so he was innovative and tenacious, community-minded. Those were themes about George. And he said, well, what if we had a neighbor helping neighbor program? And so he devised the very first air membership program. For $2 a year, you could be part of the Mercy Flights air program. And that $2 would go into this big pool, and if you or your family member needed to use Mercy Flights to be transported by air, then your transport would be provided. That membership became the very first air membership program in the nation. And now every single air program across the country has these types of membership programs. So innovation is definitely in our roots. Next slide. What Steve didn't tell you is how instrumental our community board members are. A few years ago, we set out to reaffirm the mission of our organization. After 75 years, we wanted to make sure we understood what was the purpose of our organization. And this is the mission that we affirmed by our board of directors. Continuing to save and enhance lives by delivering vital, integrated mobile health care in the skies and the valleys below. That's why we exist. Next slide. Today, we do that in a variety of different ways. We continue to provide critical care. When I say critical care, yes, it's critical, but it's through our ICU level trained flight paramedics and flight nurses. That's in either our airplanes or our helicopters. We also provide emergency care through our paramedics and nurses. And we also provide ground emergency care through our ground ambulance services. Now, Steve asked me to touch on, where are you located? Who do you serve? For the most part, we're headquartered in Medford. We serve Jackson County residents and we serve Josephine County residents. So you'll see us in the skies where we get calls from Three Rivers and we'll pick up patients. We've provided some support for the Three Rivers Hospital. So they've got a nice helipad now so we can land our helicopter and pick up a patient from the Three Rivers Hospital here and take that patient either to Portland, Seattle. We take a lot of our patients down to California, as far as Nevada. We also do a lot of ground services. So we'll pick up patients from hospitals here and take those patients to wherever they're needing to have transport. So we serve this community just as much as we serve some of the other communities in this region. The other thing that we do is more recent, in the last 8 years, is we've developed a mobile integrated healthcare service. It's a little bit newer. It's some of the first services that have been developed in this nation. And so I'm going to spend a wee bit more time on this area because it's less familiar to people. Everybody's seen our services in the helicopters and the airplanes, but less familiar with mobile integrated healthcare. So what does this do? Next slide. We launched this program in 2016 with a partnership with Providence Health System, our organization, and Jackson Care Connect. Jackson Care Connect is a Medicaid provider, one of our coordinated care organizations. And our goal with this pilot project back in 2016 was to increase health equity. We wanted to provide healthcare access to all. So with this project, we found great success by bringing care and resources to patients, particularly those patients who are using the 911 system for their primary care services. We were getting lots of phone calls, and unfortunately, those patients were using 911 to take them to the emergency departments. And we were recognizing that the reason for that is that they didn't necessarily know how to navigate the healthcare system. And so that early pilot project showcased opportunities for us to help improve the navigation of healthcare for those patients. From there, we showed a decrease in hospitalization, a decrease in the use of emergency departments, and a healthier patient and a healthier community. Next slide. So what is mobile integrated healthcare? Think of it as a very patient-centered approach. We get referrals from all over, from physicians, from hospitals, from the Medicaid program, from our public health departments, anyone that might have a contract with us. They'll call us and say, we have a patient that we need you to see. We go into that patient's home, we sit down with that patient, we do an assessment, and we develop a care plan specific to that patient's needs. Sometimes that patient needs something medical, but most times that patient needs something that's related to health education or social services. Maybe they need something behavioral health related. And so we create a customized plan for that individual. We usually see those patients for 60 to 90 days and help improve their health literacy and get them on their way. We consider ourselves health navigators and health integrators. Our care team that provides this service consists of advanced practice community paramedics, EMTs, we do have behavioral health specialists and community health workers. Those community health workers are individuals who are skilled in understanding the complexities of the insurance system. I can't even figure out the insurance system. And so having somebody who can help our patients and our community members navigate that is really important. Next slide. So when we get those referrals, we can end up meeting the patient in their home. We can meet them in the hospital. Sometimes we meet them if they're in a shelter or on the streets. Wherever those patients are located, we provide that quick response. We can provide on-the-spot healthcare because our team is licensed to provide healthcare resources. We do have a special contract with Jackson County Mental Health, and we do crisis response. This is a pilot project that we've done in the last couple of years. It's unique to this region where we get a call from either the 988 system or from Jackson County Mental Health, and their mental health specialist and our advanced trained community paramedic jointly respond to these patients who are having a behavioral health crisis. And our goal is to reduce the need for 911 to be called and the patient taken to the emergency department or the patient taken to the law enforcement, taken to the jail. We have special access, treatment centers, placement of care and outpatient services. We've done a great deal of placement in the outpatient setting to improve that outcome. We do a lot of work in the post-hospital space to be able to help people with their chronic illness and try to manage those chronic illnesses, do a lot of health education. How many of you have ever been in a hospital? I got the right crowd. So about maybe 12 hours before you're discharged, the nurse has a whole laundry list of things that they're supposed to complete with you. One of those things is an understanding of your medications, what your medical equipment that you have to pick up, what your disease state is, all that stuff. And I don't know about you, but you're on medications, you're still a little bit sick, and you're groggy, but they're having to go through all this list. You maybe retain about 5% of what that nurse is telling you. Well, the role our team plays is when we meet you in your home and your family member or your support system is there, we sit down with you and that post-discharge information, and we go through that information step by step by step. And we help you navigate how to take that medication, where to get the medication, where to connect with those social services. So we're really that individual that's going to help you prevent going back into the hospital and really get better. Next slide. Before I end this segment, I want to tell you a story about the power of it. I can talk all day about the services, but this individual really gives a good reflection of what mobile integrated healthcare can do. The gentleman in this picture was one of our patients, and the lady in the blue shirt is our mobile integrated healthcare manager, Sabrina. They met one another about 6 years ago. She was called to respond to try to meet him. He was an epileptic patient who was off of his medications. He'd been off of those medications for a long period of time. And because he'd been off of those medications, he also had episodes where he was unable to keep a job. Because he was unable to keep a job, that put him out on the streets. Because he was out on the streets, he had exposure to recreational drugs. And so he started a lifestyle that just continued to spiral out of control. He ended up in an emergency department, and Jackson Care Connect ended up connecting with him. They called Sabrina and said, hey, can you go out and meet with this individual? Sabrina spent almost a week trying to track him down because once they discharged him from the hospital, it was difficult to find where he was located. She finally found him, and he was couch surfing on his daughter's couch. She knocked on the door of his daughter's place and said, I'd like to meet with this gentleman. And he said, absolutely not. I want nothing to do with her. And so this Sabrina said, that's okay. I understand. I'll be back tomorrow. And he said, no, you won't. And she said, yes, I will. And so she just kept showing up. And after the third day of showing up and saying, I'm going to be here, he said, his daughter finally said, You better talk to this lady because she seems to not be going to go away. He said that was the best thing that ever happened to me. Because Sabrina then sat down with him and started talking to him about what were the barriers. And he couldn't find a doctor, a neurologist. He didn't even know how to do that. She finally got him into a neurologist that he liked, that he trusted. The neurologist got him back on the right medications. Sabrina then got him into a treatment program. He got clean. From that treatment program, he got a job. This happens to be one of his jobs. He is now the director of facilities in the Road Retreat, which is a center for those who are unhoused. And interestingly enough, the last Rotary club that I talked to, I was saying the same story about this gentleman, and the owner of the restaurant said, hey, it's my dishwasher. And oh, by the way, he's standing right behind you. And sure enough, there he was, and I just turned the program over to him. And what he said was that this interaction changed his life. And if it weren't for the constant willingness to show up and our willingness to help navigate the complexities of our system, he'd still be in the situation that he was in. He now has 2 jobs, he's married, he has a house, and now he's serving others. That's the power of getting out into the community and serving the community through these services. Next slide. So you may ask, and I get these questions a lot, and I'm mindful of time, how do you get paid for this? Well, interestingly enough, this is not a service that has traditional funding mechanisms. We get paid through grants and fundraising. That's why we started. We also get paid through organizations who have a like-mindedness of ours. So Jackson Care Connect, All Care, we have contracts through our All Care. We have public health contracts. But I continue to lobby all the time. Senators Markley and Wyden and anybody who will listen to me, I will raise this. In fact, we had an opportunity to do a video about this organization, and it's on our website. And we had a prominent figure be a spokesperson for us. So I'm not allowed to talk about that prominent actor who's spoke on our behalf, but you can go on our website and see that video. So by all means, we're trying to advocate on behalf of not only this community, but other communities who are trying to put these types of programs in place. All right, as I end today, I'll just mention the membership program again. This is a program that George Milligan believed in back in the 40s, and I still continue to believe in because it is an opportunity for people to have a little bit extra coverage just in case you need it. Next slide. Medical transports is expensive. Having ambulances, one ambulance is about $300,000. That's the cost to our organization. That's just the vehicle itself. An airplane is about $4.5 million when we bought it. And if we have to replace it, it's probably $6 or $7 million. And that doesn't include all of the equipment and the nurses and the pilots. So it's expensive to run it. Even though we're not for profit, we still have to make sure we're making that profit to be able to reinvest into it so we're here for the future. So it's expensive. And so we want to make sure that when or if you have to use these services, there's a mechanism to cover it, and membership helps to cover that. Next slide. We still offer very affordable memberships. In this community, it would be best to do an air membership because that's probably the membership that's going to be most utilized. For less than $100 a year, that can cover your entire family. If you don't use that membership in a year, it is a tax deductible donation. And you can think of it as a neighbor helping neighbor opportunity. Next slide. So if your insurance pays any part of the bill, then the Mercy Flights writes off the remainder of that billing. If your insurance does not pay for it, then Mercy Flights provides a 50% discount on that billing. And then there are a number of times when a patient just needs non-transport, so you show up at a patient's home and sometimes they don't need to be transported, and so those services are discounted as well. So I'm gonna end there. Let's go to the last slide and just say thank you. Thank you for what you're doing as Rotarians. Thank you for the opportunity to talk about our history and the work that we're doing here in this community. And I appreciate you and the opportunity for today. And I'll turn it over to your president.
Question. Thank you so much. That was really informative. You're a great speaker and we're so happy to have you here. Let's see if we have any questions for Sheila.
So one is, does Medicare cover multi-flights? And the other is, do you send a mental health professional with your mental health crisis inside?
Okay, so the first question was, does Medicare cover Mercy Flights? So Medicare covers our traditional services. So Medicare covers flights and ground ambulance services, transport services for the most part. There are a few exceptions to those. Sometimes those flights have to be pre-authorized. So there'll be times that the insurance company decides that it's not covered. So, but those are the fine details of any insurance company. But for the most part, Medicare does this coverage. In terms of, do we send a mental health professional when we do our mobile integrated healthcare? And the answer to that is when we're doing a crisis response, the answer is absolutely. So we partner our community paramedic, who's specially trained in behavioral health, along with Jackson County mental health specialist. And so the two of them jointly respond to those crises. Great question.
Next question.
Others? I'll give my extra.
So your Mint operation, or basically Mint does basically what you do, it sounds like here in Josephine County. So do you do that major primarily in Jackson County? Because this sounds like a lot of the, your interest is over there.
So Mint, Casey and I used to work together, so this is fun. Exciting to see Mint is expanding here. Mint is a brand new organization here in Josephine County, and Mint is really focused on providing those services to the unhoused population, and they're really focusing on trying to figure out how to get that housing and the medical care and those social services to the unhoused population, and really an important service. Mercy Flights, since we've been around for about 8 years, our service is much more broad, much more expanded, and cover more than just our unhoused population. We're also providing services to our Medicare seniors, we do IV care, chronic care management, and so much more expansive services than the Mint program. We have patients in both counties. So All Care, of course, has members in Josephine and Jackson County, and we have a contract with All Care for some of their services. And so we have patients in both. The Jackson Care Connect also has members in both counties. And we've done partnerships with Josephine County Public Health at times. And so, yeah, we try to provide those services across both of those counties. Great question.
Uh-oh, this will be the hard one.
No, it's not. This is the benefit. Would you mention about the career training for young people that you're doing? I know you personally have done a lot for that.
Yeah, I should get this answer. I just testified about an hour ago at the House of Representatives on this one. So 2021, we realized that there were significant shortages of EMTs and paramedics, not only in this region, but in the state and the nation. In fact, in this decade, they are predicting from the US Bureau of Labor Statistics over 20,000 open positions on an annual basis. This is a significant challenge for this community. If we don't have any EMTs or paramedics, when you dial 911, you may not have anybody showing up. And so this has been a problem. And we thought, well, we could sit back and just wait for somebody else to solve this problem. And that's not what we normally do here in Southern Oregon, right? We're Rotarians. We don't sit back and wait for somebody else. We roll up our sleeves and do this. So we got a bunch of fire agencies, EMS agencies, healthcare organizations together, public entities, schools together, and said, let's figure out how do we solve this. So we designed Southern Oregon's EMS apprenticeship program. It's the very first apprenticeship program of its kind in the area, and definitely a role model for the state. And how it works is it's an earn to learn program. If you're familiar with the trades, plumbing, electrical, that sort of thing, the individuals, the apprentices, are paid for a full-time job. In that time that they're paid, they learn the work on the job, and they're also paid to go to school. So they're paid for their tuition. What's unique about our program is we're tapping into underrepresented populations in our community, particularly our Hispanic community. So we look around our community and we think about diversity, we don't see a lot of Hispanic EMTs and paramedics, but yet we have a lot of Hispanic members of our community. And so we started engaging with those community members and bringing them in. And it's fun to see that those groups of students, and because we're tapping into these different populations, we also recognize that we have to do some additional wraparound services. So sometimes English as a second language, sometimes we have to think about housing and food insecurities, childcare. Sometimes we have to think about financial management, budget management. And so we're trying to put an all-encompassing program together. We're seeing some great success. We put a career technical education program in place with Phoenix Town High School. We expected about 20 students to sign up this fall. Do you know how many students signed up? 75. 75 students. Now we've got Grants Pass High School who's saying, hey, what about us? And we're saying, yeah, let's do this. Let's partner, let's expand this, and let's take care of Southern Oregon. So we have enough EMTs and paramedics to serve this region for now and into the future. Thanks for that question. Yeah, great.
Again, this is so educational, informative, and really appreciate that you're here and that you're in our community. And I'm so excited because we actually have time for sergeants today. Who's our sergeant?
I think it's me.
All right, Doug.
Good.
You should be able to collect off of every single person in the crowd, right? Or no?
Yeah, we should. So we have, for Sergeant's Day, I asked a few people to tell stories about either Thanksgiving or Christmas, something in the past, and I'll share mine that I'm kind of grateful for. Is that we used to go to my father's, one of his relatives' family's house, or maybe they'd come to my dad's house. We didn't go to my mom's family's house because they were all scattered and lived far away. And my memory of that is as a kid going there, and there'd be the grouchy uncles sitting in the living room watching the football game, having a cocktail, being grouchy. And then there was one uncle that would always go outside and play catch with me for half hours. And that was just a wonderful memory from childhood. And then, so if any of you have any memories from childhood or whatever, Christmas, Thanksgiving, want to share it. Margaret, I think you were going to share one, and then we'll go happy butt. Where's Margaret? There she is. And then others, if anybody has any stories.
Well, I didn't think I had a Thanksgiving story, but I remembered a time, when I was about 19 and living in one of my first apartments. And I decided to have Thanksgiving dinner for all the people in the apartment building who were my age or didn't have family to go home to. So, I ordered a duck. A goose. I ordered a goose because I like, wild rice and sausage stuffing, and I thought, well, that would be good. And I sent my boyfriend to pick it up, and it was frozen, so he had it cut in half, long ways. It's hard to put stuffing in a bird that's been cut in half. Well, fortunately, he was a leather worker, so he got his needle and thread out. And he did surgery, he sewed the thing up, and I was able to stuff it.
Anybody, have any little quick stories they want to share? No, Janie? Yeah, please.
Okay, so my whole life I've loved the Macy's Thanksgiving Day Parade. My family knew I can't do anything until the parade is over, but I can't miss the parade. To the point where we'd say to each other, Happy Macy Day instead of Happy Thanksgiving. And about 15 years ago, I bought a ticket when the Grants Pass High School band was gonna go and appear in the Macy's Thanksgiving Day Parade. Some local shops were selling raffle tickets to win a trip to go with the band. And they were like $5 raffle tickets. So I bought 2 or 3 and I won. And I got a bill to New York. And now every year at Thanksgiving, when I'm watching the parade, I'm like, remember when I was there and sitting underneath this giant blue. So it's just like my favorite thing.
You. Donna?
So mine's sort of a heartfelt type of Thanksgiving memory, and it's actually just last year. For the first time in almost 40 years, my younger sister and I spent Thanksgiving with our dog, who by the way is going to be 88 in February. And I'm going to be gone for the winter because I'm going to take care of him. He doesn't get along very well, and he hates the winter, so I'm going to go cheer him. So that was the night Dad danced with both me and my sister. It was just, it brought tears to our eyes. It still does when I talk about it. So that's my heartfelt Thanksgiving.
I have a quick story because it's a funny memory. My father was the guy who went out to catch with the kids, or went out to the kite with the kids, or always did that Thanksgiving. So it was always a joy to come and have my dad take the kids and take them out of the park. Crazy. One year we were doing that, we came in the house, we were all visiting, and all the grandchildren who were out playing, because we would get them out playing, had climbed a tree outside their house, on the side of the house, and the whole tree went. Ooh, and nobody got hurt, but they were all sitting on top of this. And so it's this poopy tree. They were all sitting on it. We all watched as they all went. Ooh.
Yeah. Did Don, did you consider that? No. Somebody over there? Somebody. Oh, Jenny. Hang on a second.
So Thanksgiving is my very favorite holiday. And I think you've heard me speak of Bobby Kidder poems. There's a line that she has, and then the moment was gone. And that's my favorite line of poetry on earth. And so I pay attention for those moments. And my favorite Thanksgiving memory was about 5, 6, 7 years ago. And I had 18 people come to my house and stay at my house for 3 or 4 days. And I love to cook. So I cooked all day. The power went out first thing. So we got the generator out, we got things up. It was the perfect Thanksgiving meal. And after that, we were all piled on my big giant couch in my living room. And I was so exhausted that I actually fell asleep in a pile of people. And those of you that know me, I don't fall asleep in my own bed by myself very well. And I woke up after about a 2-hour nap, and my family was around me, and that is the happiest moment of my entire life. And we were watching the Queen concert, one of the old Queen concerts in Quebec. And it's just, I don't know if I'll ever top that day.
Okay, anybody else? Full story? Who are you pointing at, Bella? Dave, did you want to share? No? Okay. Oh, Christmas is fine. It could be Easter even.
Well, when we first met, I was, lured to Thailand to visit her parents and sister. And we were there for, Thanksgiving, Christmas dinner. And what was interesting about Christmas dinner was the interpretation by the Thais of a reindeer. Dressed as a reindeer, rusty foot, and he barked. I'll never forget that.
Cute. We'll go on to Happy Bucks. Does anybody have Happy Bucks you want to share? Beth?
Happy birthday to Doug for tomorrow. It's today is Johnny's son Chris's birthday. And a couple days ago was my daughter's Maddie's birthday. And I'm really happy they both inherited creativity and empathy from Doug. So it must be a Sagittarius thing or something, I don't know, but they're both really Rotarian oriented and all of that, so that makes me happy.
Yeah.
8 of us played pickleball this Thanksgiving. And while the turkey cooked.
Speaking of Sagittarius, my daughter from Austin was just here this last weekend because she didn't want to come up Thanksgiving, Christmas was in traffic, so she came this last weekend. And she is also a very service-oriented person, and so it was absolutely wonderful having the opportunity to spend the weekend really looking at all the Christmas stuff going on, and all she wanted to do was stay home with us. So we had a great time and decorating the Christmas tree, and it was pretty special.
Other Happy Bucks? Dara?
Thank you so much, Sheila. That's for you, and it was a fantastic time. And I'm very, very familiar with these helicopters that come around the hospital. I worked with both my husband and I worked in Pennsylvania, the guys in the hospital. And whenever we hear that, we say, oh no, it means your evening is gone. You're probably going to help with this wonderful. And another thing is for the backpacks tomorrow or tonight. Yes, yes. Thank you. Yes. Thank you.
Jody's like our Christmas. I have 6 Happy Bucks for the 6 students that I interviewed today in the mock interviews with Jim and Debbie. We got some really, oh, and Mary and Greg were there too, because they were kind of off the same too. But they were late. I grew up at 7. Anyway, so they were tardy and I write them a little slip. You know, they had to go to the office. That's why I forgot about it. Anyway, it was a great time, and if you ever get a chance to do it, we always, we do it once a semester for the Career Academy class. We always have an email, Doug usually relays it. So if you can spend a day with 6 or 8 really sharp kids, you'll be inspired.
Yeah, anyone else? Yeah.
Many of you know Calvin or have heard my stories, but I have a new favorite story, and I've told it a couple times already today. But Calvin's favorite thing to do is drive around and look at Christmas lights. And so I take him every night. It's a good way to calm down his little ADHD brain. And we have one house in particular on our street or down the street that he loves, and they always do a big nightmare before Christmas display. And so we've been patiently waiting, and the other night we drive by and they changed their theme, and it's a really nice nativity scene. It's beautiful. And he looks at it and he goes, Jesus, what the heck? So that's been my new saying. A couple weeks is, Jesus, what the heck?
Well, and activities abound, but Monday and Tuesday is the Grants Pass High School Band Choir Orchestra holiday concert, and it's always fantastic, so I encourage you to go to that. And then Wednesday, I belong to the organization PEO, educational organization that gives scholarships to women. And we're having a fundraiser for the Velveteen Rabbit, and I still have a couple of tickets left if anybody's interested. So pay heavily for that.
And I think that first thing with the high school band, that's also a fundraiser when you buy tickets to get there, right? Yeah.
Be very brief, but I just want to piggyback on what Greg just said. You meet these kids and some of them are super shy and others are, you know, high extroverts, but they're really nice kids. And, you know, you come away, I personally feel hopeful. I mean, they're good kids and their hearts are in the right places. It's just kind of uplifting.
And I left you happy bucks here to say I have a greater chance of winning. That's not fair.
Yeah, no, Lisa, she's up there though. And
I just have some happy bucks. I want to thank Patty Hansen and Dawn Welch for their leadership in organizing the applications for March Fest and getting us going on that. And we've got most of the paperwork finished, ready to go. It's a lot of work. And so thank you very much. Happy bucks to you.
yes, thank you, Patty, for that. And Dawn. I have two sort of happy bucks as well. I'd love to see hands for anybody who's interested in buying sawhorses from the high school construction class for Christmas presents or whatever you want. If anybody wants sawhorses, raise your hand. Oh, to you? No? No, okay. Nobody wants to buy sawhorses. The other thing is, if anybody out there has any extra coveralls, because the kids that come to the construction class are coming in their street clothes and then we're sometimes doing stuff that's dirty and messy. And so I don't really have enough coveralls for them all. So if anybody has any spare coveralls left over in the shops or something like that they don't need, we would love to have them. Please. Okay, the card draw today was 10 of spades.
We still got it online.
10 of spades. Did we sell them? You got it?
I got it.
All right.
Well, thank you, everyone. It's so nice to have time at the end of the meeting to do happy boxes and sharing. We've kind of gotten off kilter with timing. So thank you for your patience as we work back into that. We're going to see you next week for the Christmas ornament exchange and fun times. And I want to share with you a thought for today from Mother Teresa. Joy is prayer. Joy is strength. Joy is love. Joy is a net of love by which you catch souls. Have a great week. We'll see you next week. Thanks, everyone.